Hi everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about something really cool. We're going to be talking about why some women feel menopause symptoms during the breastfeeding time or even the immediate postpartum period. It is such a challenging time for women. It is an exhausting time for women. It's also a very gratifying time for women, and it really does test a woman and their family with the understanding of who they are and really what family means and the commitments that we're willing to make during breastfeeding. It's a tough time. That postpartum period is a really tough time. And so whenever I think about why women go through certain phases in our life and some of the negative symptoms and consequences that may result, I start to try to think, why? What is the evolutionary advantage to this? Is there a purpose for these natural feelings and phenomena that we go through? Well, that's today's video, so let's get to it. So, during the pregnancy, the placenta starts to make lots of estrogen and progesterone. This secretion of estrogen and progesterone really makes women feel beautiful. It makes us have lots of nice flowing hair, and it gets us just really excited for the birth of our baby. Then what happens when the placenta is delivered? It's that immediate decline in estrogen and progesterone that allows a special hormone called prolactin to rise in our brain. That change in concentration allows prolactin to stimulate our breast tissue to prolactate, to lactate, to start breastfeeding. Now, breastfeeding is super hard, and just because maybe not everyone was successful at breastfeeding doesn't mean that they still won't feel a lot of these symptoms, but it's that initial switch, that concentration change that elicits a lot of these feelings and experiences that women have post-menopause. Post delivery. So what happens is one of the first things that women notice during that time after delivery for several weeks or even months, depending on how long they're breastfeeding, is hot flashes. So what's up with that? Well, did you know that many of the symptoms that I'm going to be describing are actual symptoms that women experience during the menopause? But there's actually a biologic reason why we experience those symptoms, hot flashes, during the immediate postpartum state. Now, those rise in temperature, thermoregulatory centers in our brain, and that lead to skin vasodilation and even a little bit of sweating, will actually be there to help the baby become nice and warm. And so when we do skin to skin on babies, those elevations in temperature allow for radiant warming of the baby so that the baby feels nice and warm. And so that biologic function of hot flashes that come with decline in almost menopause state estrogen levels during the immediate postpartum state and through breastfeeding will help the baby transition through those late night snuggles that we do during the postpartum state. Now, also insomnia. So low estrogen also tends to bring about some insomnia in women, and it's a common complaint that women experience in the menopause state as well. But insomnia is exceedingly useful, but not fun to go through during the postpartum state as well. Now, why? What do you think evolution, and what do you think about our biology? What is the function of this? Well, the big function is that we need that semi-alert state as women, as mothers, to keep track of our baby during that nighttime state, to make sure that the baby is breathing, to make sure that we're paying attention to the baby when it's crying. I know that when I was in that postpartum state, I could hear things like in the next room that I don't think anyone else could hear. It's that hypervigilant state that is very evolutionarily useful to a new mother to keep track of their baby, to make sure that their baby isn't under a stress from crying too much, from not being taken care of, because maybe we just don't hear it. And so if you feel like you just can't concentrate on anything else during that postpartum state or breastfeeding, it has to do with the evolutionary advantage of low estrogen to keep us semi-alert. But yes, a lot of women in menopause period will also experience the same thing when they go through that low estrogen state. But the evolutionary advantage for a woman in the postpartum state is to really make sure that they're taking care of their baby. Now, it's really hard. It's really hard to work on no sleep, and it's one of the biggest challenges that we have as postpartum women. But there is an advantage. One of the other common complaints that I hear of women when they come and see me in the gynecology office is that they just don't have any more libido during the postpartum state or during their breastfeeding time. Now, that is actually evolutionarily advantageous. And if we think about the reasons why, estrogen is the hormone that kind of makes us feel like a woman. It's one of the big hormones that spikes during our ovulatory period. It makes us feel like we really want to be close and have that intimate moment with our partner. However, during the postpartum state, your estrogen level is supposed to be low so that you can kind of keep track and just use your resources on breastfeeding one baby at a time. Now, if you're having a lot of time and devoting to your baby during that breastfeeding state, it might not be a time to have another baby, which evolutionarily, it keeps our estrogen level low so that we can just keep track of one kid at a time, so that we cannot be biologically interested in having another baby while we're spending so much time and resources on the beautiful time of breastfeeding. And so yes, so the decrease in libido, but also the decrease in kind of estrogen levels in our vagina and our vulvar area. A lot of patients tell me that even if they are slightly interested in having sex during the breastfeeding period, their vagina and their vulva feels really dry, and it's really difficult to lubricate during that time. And so a lot of times we're prescribing women during that postpartum period or in that lactational period some topical estrogen cream to help them so that they can actually experience less of the vaginal dryness that is so common during the lactational state. Now, a lot of other interesting phenomenon that will happen is there's actually a decline in calcium levels and bone loss in our spine. And that has to do with the lower estrogen state helping to mobilize some of that calcium for breastfeeding, which is really exciting. And so, however, when we resume our menstrual cycle, that bone loss is reversible and goes away. But it also kind of mimics what happens in the menopause time when ladies experience low bone density as well. And that has to do with declining estrogen. Finally, one of the big complaints that I have a lot of patients come and see me about is loss of hair. They're usually around 3 or 4 months later after delivery of the baby. They're calling my office complaining of like lots and lots of hair loss in the shower. They're losing all kinds of hair. They usually are really concerned about their thyroid, as there's some sort of thyroid condition. But usually after the 3rd or 4th month from delivery, that hair turnover that happens at the level of the follicles will start to let go of a lot of our hair that we grew during our pregnancy because of all of the wonderful estrogen. And so, yeah, it's really sad. I experienced it too, but a lot of the hair loss that we experience in the lactational period, it's actually similar to what might happen in menopause too. But yeah, the estrogen, it's one of those hormones that is very helpful for a woman during our womanhood. However, those ebbs and flows, those natural rises and declines lead to a lot of the side effects that can sometimes be uncomfortable during big momentous phases in our life, like lactation, childbirth, but also the perimenopause period. So a lot of people wonder, when do those unwanted symptoms end during the lactational period? Well, it biologically makes sense that when the baby is less reliant on your own nutrition to take care of the baby, and maybe the feeds start to space out a little bit, is when the triggers in the brain will know, oh, okay, I have enough nutrition and the baby is being able to sustain itself, so I'm going to go ahead and allow ovulation to resume. And those signals in the brain are very much modulated by glucose and insulin. Of course, right? And so if they're modulated by glucose and insulin, then once your body senses that it has enough nutrition to proceed with another pregnancy, then ovulation will occur and your menstrual cycle will start, and the estrogen levels will increase and decrease just like they did before. And you'll probably feel more normal at that time too. So anyway, I just wanted to share because I really do think that biologic function is very interesting, and whether or not it's something easy and hard, easy to chew on during that period when you're experiencing, yeah, I understand. But to me, when I'm teaching this information to my resident doctors, medical students, but also patients about why things happen the way they do, it's a lot easier to understand when we look at it in terms of biologic function and need. Well, that's it. I hope that you like this video, and if you do, please go ahead and subscribe, share it with a friend, hit the like button, and we'll see you next time.